What is the independent variable in research? Options are A, the result of the experiment, B, the variable that is measured, C, the variable that is manipulated or controlled by the researcher, D, the participant's age. The answer is C, the variable that is manipulated or controlled by the researcher. Let's understand the concept of independent variable and dependent variable. So the first is independent variable. So the independent variable is the one that the researchers changes or manipulates. So here you can see clearly visible the researcher, okay, he is applying a fertilizer. You can name it as an X fertilizer for an experiment. Okay, so this applying the biofertilizer is the independent variable. So the independent variable can change or manipulate by the researchers to observe some of its effects. Okay, so that is independent variable. Now let's see the other concept, that is dependent variable. Dependent variable, so simply dependent, which is depends on the independent variable. Dependent variable is depend on the independent variable. Now see the explanation. So here the dependent variable will be the plant growth, the number of leaves and number of fruits. Okay, so definition is the dependent variable is simply the outcome of your experiment. So here the outcome of the biofertilizer, since you are applying the biofertilizer X, what can be the changes you can observe, that is the dependent variable. So the plant growth, number of leaves, number of fruits will be depending on the biofertilizer X that you are applying. Hope the concept is clear. In a research study, what is the dependent variable? Options are A, the variable that is manipulated, B, the outcome being measured, C, the variable that causes the change, D, the group receiving no intervention. The answer is B, the outcome being measured. In a study examining the effect of medication on blood pressure, what is the independent variable? The options are A, blood pressure, B, the medication, C, the nurse administering the drug, D, the patient's weight. The answer is B, the medication. The medication is the independent variable because it is what the researcher is testing to see. And the effect will be the blood pressure. So blood pressure will be the dependent variable. The blood pressure will depend on the medication. What is a sample in nursing research? Options are A, the total number of patients in a hospital, B, a subset of the population chosen for a study, C, the entire population under study, D, a group of nurses working in the same unit. The answer is B, a subset of the population chosen for the study. So a sample is a subset of the population selected for participating in a study, and it is used to make inferences about the entire population without studying every individual. What does population mean in research? Options are a group of hospitals in the country, B, a group of individuals with similar health conditions, C, the entire group the researcher wants to study or make conclusions about, D, all the doctors working in a hospital. So the answer is C, the entire group the researcher wants to study or make conclusions about. So in a research, the population is the complete set of individuals or elements that the researcher wants to study or generalize the findings to. Random sampling or probability sampling includes all the following techniques except. The options are A, purposive sampling, B, cluster sampling, C, simple random sampling, D, stratified random sampling. The answer is A, purposive sampling. What is the purpose of sampling in research? Options are A, to study only the most important people, B, to make research more difficult, C, to collect data from a representative group, D, to ignore the population. So the answer is C, to collect data from a representative group. Sampling is used to collect data from a representative group, so that result can be generalized to the larger population. Which of the following is a probability sampling method? The options are A, convenience sampling, B, snowball sampling, C, simple random sampling, D, quota sampling. The answer is C, simple random sampling. In simple random technique, each individual has an equal chance of being selected. The others in the options are non-probability method. In non-probability sampling, which of the following is true? Options are A. Every member of the population has a known chance of being selected. B. Sampling is always random. C. Some members have no chance of being selected. D. All members are selected equally. The answer is C. Some members have no chance of being selected. That is the non-probability sampling. Not all individuals in the population have a chance of being selected, so which may lead to bias. Which sampling method is best for reducing bias in nursing research? Options are A. Convenience sampling, B. Judgmental sampling, C. Random sampling, D. Purposive sampling. The answer is C. Random sampling. The random sampling ensures each member has an equal chance of being selected. So, this will reduce the bias and improves the validity of the study. Which sampling technique involves using people who are easiest to reach? Options are A. Simple random sampling, B. Systematic sampling, C. Cluster sampling, D. Convenience sampling. The answer is D. Convenience sampling. So in this method, we select the participants who are readily available for easiest access. So it is quick, but it may lead to bias. The plan how a study will be conducted is called. Options are A. Design, B. Research process, C. Hypothesis, D. Data collection method. The answer is A. Design. Researchers should ensure that participants under study must give. Options are A. Informed consent, B. Informed choice, C. Informed participation, D. Informed challenge. The answer is A. Informed consent. Which sampling method ensures equal representation of male and female participants in a study? Options are A. Convenience sampling, B. Stratified random sampling, C. Snowball sampling, D. Purposive sampling. The answer is B. Stratified random sampling. So the stratified random sampling divides the population into smaller subgroups, for example, gender, and randomly selects participants from each strata. Which of the following is a type of probability sampling? Options are A. Convenience sampling, B. Quota sampling, C. Simple random sampling, D. Purposive sampling. The answer is C. Simple random sampling. Simple random sampling is a probability sampling method where every individual has an equal chance of being selected. The others over here are non-probability methods. In which sampling method is every kth individual chosen from a list? Options are A. Cluster sampling, B. Stratified sampling, C. Systematic sampling, D. Snowball sampling. The answer is C. Systematic sampling. So as you can see in the picture, systematic sampling is every kth element. So here it is every third person from a list after a random start will be selected for the study. Main advantage of probability sampling. Options are A. Quick and inexpensive, B. Ensure diversity, C. Reduces sampling bias, D. No sampling frame needed. The answer is C. Reduce sampling bias. Quota sampling is based on. Options are A. Random selection, B. Proportional subgroup representation, C. Convenience, D. Lottery method. The answer is B. Proportional subgroup representation. Quota sampling ensures subgroups are represented proportionally. Major disadvantage of convenience sampling. Options are A. Time consuming, B. Costly, C. Low generalizability, D. Needs large sample. The answer is C. Low generalizability. The convenience sample may not represent the whole population well. Best for a large spread out population. Options are A. Simple random sampling, B. Cluster sampling, C. Purposive sampling, D. Snowball sampling. The answer is B. Cluster sampling. The cluster sampling is efficient for large geographically dispersed populations. Selecting proportionally from hospital departments. Options are A. Cluster sampling, B. Convenience sampling, C. Stratified sampling. D. Snowball sampling. The answer is C. Stratified sampling. Stratified sampling, where the population is divided into two or more groups called strata, and it ensures proportional representation of subgroups. Equal and non-selection chance method. Options are A. Simple random sampling. B. Snowball sampling. C. Convenient sampling. D. Purposive sampling. The answer is A. Simple random sampling. Every member here has a known and equal chance of being selected. Common in qualitative nursing research. Options are A. Systematic sampling. B. Simple random sampling. C. Purposive sampling. D. Stratified sampling. The answer is C. Purposive sampling. So the sampling technique here is totally rely on the judgment of the researcher, and it is otherwise known as judgmental sampling. The concept of statistical power in the social and behavioral science was first introduced by options are A. Kolmogorov, B. Carl Pearson, C. Spearman, D. Jacob Cohen. The answer is D. Jacob Cohen. Which of the following principles is followed to determine the sample size for qualitative research? The options are A. The thumb rule, B. The rule of 30, C. Data saturation, D. Power analysis. The answer is C. Data saturation. The process of selecting a subset of population for survey is known as options are A. Survey approach, B. Representation, C. Triangulation, D. Sampling. The answer is D. Sampling. Blueprint plan of a research is known as options are A. Research design, B. Sampling, C. Hypothesis, D. Assumption. The answer is A. Research design. The development of a solid foundation of reliable knowledge is typically built from which type of research? Options are A. Basic research, B. Action research, C. Evaluation research, D. Orientational research. The answer is A. Basic research. Quantitative research is a process to options are A. Evaluate theories and hypotheses, B. Develop theories and hypotheses, C. Describe social phenomenon, D. Obtain experiences and feelings. The answer is A. Evaluate theories and hypotheses. A hypothesis which a researcher tries to disprove is options are A. Positive hypothesis, B. Research hypothesis, C. Null hypothesis, D. Alternative hypothesis. The answer is C. Null hypothesis. Gender, age class, religion, type of disease, and blood group are measured as options are A. Ratio, B. Nominal, C. Ordinal, D. Interval. The answer is C. Ordinal. Which scale of measurement has an absolute zero? Options are A. Nominal, B. Ordinal, C. Ratio, D. Interval. The answer is D. Interval. The degree of freedom in a table with 3 rows and 2 columns. Options are A. 1, B. 2, C. 3, D. 4. The answer is B. 2. If you like the video, please like, share with your nursing friends and subscribe the channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.